All patients, and particularly in my practice where people are old and frail frequently, oftentimes demented, have to place their trust in someone who will be their advocate. And when I take a patient on as my patient, there's a bond between us. And even if I don't agree with the patient, even sometimes when I don't like the patient, I have to honor and respect that covenant, to do the right thing for the patient.
I was diagnosed with ovarian cancer in 1994, and it was sort of rapidly spread to my liver. And I went through an 18-month healthcare experience that I described carefully as an Odyssey experience, because I think it was no less perilous than Odysseus's journey. But I came upon a man who became my GYN oncologist, with whom I had a remarkable relationship. I think he was very careful to understand exactly who I was and who I am and what my values are and what my priorities and goals were. And I trusted him absolutely. So if the best I could do was be out cold for surgery or be home trying to recover from the devastating effects of chemotherapy, I trusted him on the tiller. I felt that trust in him because he loves me, and I felt it. And he doesn't love me in a way that, you know, you love your daughter or your wife or your whatever. He loves me in the way you love your patient. And his commitment to me is powerful, very, very powerful. And I feel the same way to him.
In our rush to measure professionalism, we have pretty quickly dissected it into these behaviors. And what we are at great risk of losing is the bigger context of the medical professional, and more importantly, the virtues of the professional. And that's what I want my students and residents to focus on, the individual relationship that they have with their patients, and to recognize that that relationship they have with their patients has to take place in the context of a population of patients in the community that they serve, but that it must be done with the highest integrity, with altruism, and with deep compassion for what are often the most vulnerable members of our society.
As I think about my practice and relationships, one example really sticks in my mind. I have a patient who actually has a number of chronic conditions who had a real hard time making it to her appointments. And the staff came to me concerned that, you know, she's late, she misses appointments. I think we need to discharge her from the practice. But I knew that she had a lot of chronic illnesses that really required a lot of attention. So I asked her, I said, it seems you're having some trouble. Tell me what it's like for you to get to clinic. And she proceeded to tell me this amazing story of the challenges that she faced. She lived 90 miles away, and she had to take 3 or 4 buses and trains to get to the clinic. It took her like 3.5 hours. Well, I didn't realize that. It cast her situation, her life experience in a whole new light. Now, it is true she had missed the appointments. It is true she had been late a number of times. But I feel like that by investing some time and talking about that with her, it helped me to sort of, rather than see her as the non-compliant patient, I saw her as someone whose life was affected in profound ways by her illness and by distance, and that I needed to work with her to figure out how can we make that work, that you have to come this distance. So rather than give her an appointment early in the day, whereas she'd have to get up at 5 a.m., we decided let's make appointments that are going to make it more feasible for you to get here in a timely manner. So that was a really powerful experience for me.
I'm always surprised at how much doctors don't see what we see, don't know what we know, don't understand how much patients do see into the system. And I think there are many physicians who are devastated by the lack of medical professionalism in the system, and I think we are a real arrow in their quiver, if you will, that they don't see. Patients can be really useful in a sales kind of way, in a reaching other patients kind of way. Whether we like it or not, doctors don't always have the best rap with patients. So if I'm a patient and I'm a consumer leader, if I can provide leadership with my fellow consumers and say, hey, this institution does a really good job of this, and here are the 3 things we need to do as we step into this experience as patients so that they can do their best job.
Work is work, and it's a set of activities, and you do them. And remembering why you do them, I think that's the core of professionalism. That core hasn't changed. Hippocrates didn't use antibiotics, he didn't have x-rays, he didn't do a lot of successful surgery, but the impulse to be of service to patients, that's a durable thing within medicine, and it's a privilege to keep doing that. Different days, different weeks, different phases of career, you feel closer to that or further from that based on how much energy you have, based on how well the systems are running, based on what kind of day you're having. But the durable reason for doing the work, that has not changed.